Biostimulation is a qualified technique of aesthetic medicine which has been used for many years. The goal of this method is to stimulate the patient's skin in order to produce more collagen and elastin. The substances used provide the precursors for the synthesis of collagen and elastin, as well as other important antioxidants to counteract the action of free radicals on the skin and all agents causing a more pronounced skin aging, while at the same time hydrating the skin. Remember, hydration is not only useful for the greater well-being of the skin, especially of dry and very dry skin, but it also facilitates intercellular exchanges and is therefore extremely useful to accelerate cell turnover. The treatment is carried out by injecting small doses of product in the middle dermis with the help of very fine needles. The treatment is not very painful, and the technique used vary according to the area in which the product is injected. We can use the micropapial technique, inserting only the tip of the needle and injecting a small dose of product. We can use a linear anterograde or retrograde technique, inserting the entire length of the needle and injecting the product while inserting the needle or while retracting it. We can form different designs on the face to make sure we have covered the entire surface of the skin. For example, we can make the design of a grid or a fan. What are the results that we can expect from this type of treatment? Surely, the clinical outcome is not particularly appreciated by the patient when looking in the mirror. This is not a filler. It does not produce a change in facial volume or a major change in the depth of the wrinkles, but we can increase skin radiance and firmness, making the skin more compact while improving the appearance by minimizing the pores. One of the limitations of traditional biostimulation, the one performed with non-cross-linked hyaluronic acid or with substances such as vitamins and amino acids, is surely its duration over time. These substances remain in the skin from a few hours to a maximum of 48 hours. They stimulate the fibroblasts, but then are completely reabsorbed, and therefore their action is limited in time, although their effectiveness is definitely proven. Another limitation that certainly does not promote patient compliance is that several sessions are necessary to get the desired clinical effect. So generally, with most of the products, we must perform 4 to 6 treatment cycles, weekly or bi-weekly. Another important limitation, which is perhaps the most important one for the patient, is the soreness from the injection and the fact of having to make many injections on the face, and therefore we have more injections, more pain, more chance of bruising or hematoma, which the patient will have to hide with makeup, and in some cases a few days must pass before the skin returns to normal. So, for us, this is a limitation. Now, given the limitations of traditional biostimulation, we will look at the technology of this new product, Profhilo, which allows us to obtain a greater permanence of endogenous hyaluronic acid in the dermal layer while maximizing the action of the hyaluronic acid itself. This is due to a prolonged action over time, because Profhilo is a newly conceived hyaluronic acid, attacked 8 times less by hyaluronidase and free radicals, which tend to catabolize the substance, and therefore has a longer duration without the aid of cross-linking bonds. This is crucial because we must remember that Profhilo is a natural hyaluronic acid without addition of chemicals to extend its life. This very high concentration of 32 milligrams per milliliter of hyaluronic acid, thanks to its patented formulation, is however extremely manageable, not only for the injection, as we use a 29-gauge needle, but also regarding the spreadability of this product in a very homogeneous way in the dermis after being injected. One last point that I consider important is the reduction of the inflammatory response. This hyaluronic acid, these hybrid complexes that form Profhilo, produce a lower activation of the TGF-beta compared to natural hyaluronic acid, and therefore produce a lower inflammatory response, a lower production of free radicals, and the further reduced degradation of the hyaluronic acid. With Profhilo, we are introducing a new approach, bioremodeling, which is obtained by two features of this product: its content of hyaluronic acid at both high and low molecular weight. Profhilo allows us to counteract skin laxity while improving and restructuring the skin owing to the bioregeneration trophic action of the hyaluronic acid at a low molecular weight, and thanks to the plastic remodeling action of hyaluronic acid at a high molecular weight. The innovative characteristics of Profhilo allow us to use a new technique, the BAP, or bioaesthetic points technique. This technique has been specifically designed to treat the middle third and lower third of the face, which are the areas that most frequently show a lack of skin tone and increased laxity that makes the face look more tired and wrinkled. This technique is based on only 5 injection points, and for every point we inject 0.2 milliliters of product using the bolus technique. The product allows us to reduce the points of intradermal injection and also reduce the number of treatment sessions. And it is very easy to identify the 5 points of injection. The first point is located on the zygomatic protrusion, about 2 centimeters from the external corner of the eye. The second point is located at the nasal base, 1 centimeter away from the nostril. The third point is about 1 centimeter anterior to the tragus, more central on the face. The fourth point is found at 1.5 centimeter from the oral commissure towards the center of the lip and 1/3 down towards the chin. The fifth and final point is on the mandibular protrusion, 1 centimeter above the mandibular angle. The protocol requires 2 treatments with a 1-month interval, followed, if necessary, by a maintenance session of 2 months after the last treatment. The BAP technique was developed to minimize risks and maximize the diffusion of the product. These bioaesthetic points were specifically chosen away from major vessels in order to reduce the risk of compression or embolization and the formation of hematoma, and also away from large nerve branches to minimize the risk of compression and reduce patients' pain. Thanks to this new BAP technique, the bioremodeling with Profhilo ensures great satisfaction for both the physician and the patient. The patient has an excellent compliance due to reduced pain, number of sessions, and points of injection, but also a greater satisfaction for the clinical effect of greater compactness and increased turgor of the skin, already visible a few days after the first treatment. The doctor surely has a greater satisfaction for the results obtained, but also a notable ease of application with this method, thanks to the extreme simplicity of injection of the product, of the execution of the BAP technique, and thanks to the highly effective and visible clinical outcome. Profhilo is an extremely valid product for skin remodeling. It helps counteract skin laxity and is able to respond to the expectations of both doctor and patient, even in advanced aging situations.